You know, absence can make the heart grow fonder, but for your pet, absence can make the heart grow anxious. Larry Mealer here. Thanks for joining us on WPR News, talking your pet's health on the show today. And to start the program, we're talking about separation anxiety with Dr. Bill Stork, owner of Lake Mills Veterinary Clinic, also the author of several books. We'll look at what causes separation anxiety, how it's diagnosed, and how to treat it. And as we talk with Dr. Bill, I want to hear from you. Do your pets seem anxious? Maybe they're destructive when you leave them alone? Do you have other general health care questions relating to your pet? I hope you'll join in. Number to call is 800-642-1234, or you can send an email to talk@wpr.org. Dr. Bill, welcome back to the show.
Well, good morning, Larry. And that is the perfect metaphor. And I think you may have just come up with the title for our next Pet Partners lecture at the Lake Mills Veterinary Clinic. Absence makes the heart grow fonder or anxious. And over the years, and it's one of these perspectives that comes with time in the saddle, but back in the day, we used to have to worry about how we were going to get through the day with families that have brought home a new puppy or a new dog. When most families, people worked 8-10 hours a day. So we had to figure out which neighbor, family member, or school kid was going to be able to let the dog out in the middle of the day. Well, time goes marching on, and along comes people who have retired and have the ability to be home with their dogs all day. There are flex schedules, work from home, all kinds of intricacies. And it seems like more frequently we will hear, oh, it's great because I'm a teacher and I'm home for the summer, and we won't have to leave him alone at all. And my instant response is, well, that's fantastic. The flavor of the day at Culver's is dulce de leche cheesecake. So leave the dog at home in the crate and give that puppy or give that newly adopted dog time home alone, because from the get-go, we want to get these guys used to all of the situations that they're going to encounter. And we work hard we've talked endlessly on this program about getting dogs socialized with other dogs, with other people, with other places. For people who are fortunate enough to live out in the country, we encourage them to bring their dogs to town so they get used to, there's not a lot of commotion in Lake Mills, Wisconsin. We're pretty fortunate that way. But still, it's not the end of a dead-end road in the country. Same goes for alone time, and really valuable right out of the gate. And you don't have to be gone for 3 or 4 hours at a stretch. But what is important is that they get used to being home alone, and they know the difference between the crate is downstairs and mom or dad is upstairs working from their at-home office. They know the difference.
And I expect especially, and you were talking about a new animal, a new dog, or maybe a new cat coming into the home, that if it's very young, you want to get that started. You want to get them started right off the bat, don't you? Even at 6-7-week-old animal.
Absolutely. And our behaviorist here at the clinic, Mitzi Voiles, says a lot of things. And a piece of advice that I have heard her dispense before is that how you leave and how you return makes a big difference. And it seemed a little far-fetched to me at first, but I've actually seen these things make a difference. And what that means is the temptation is that when we leave, we want to assure the puppy, we want to assure the dog that everything is going to be okay. And we speak in a high-pitched voice and we reassure them, and we feed them treats, and we leave and we go and we come back. If they're barking or complaining at all. And then when we come home, then we return with a high-pitched voice and all kinds of excitement. The dog's panting and getting all excited. What we prefer, until we know that the dog is going to be okay when we leave and when we come home, is that the old Irish goodbye. My wife gives me a hard time because when I leave a party or a family gathering, I just leave and just walk out the door. Otherwise, it takes hours to get to leave. But the same thing with the pets. You just stone cold stoic, just walk out the door, no fanfare, no high pitched voice, and return the same way. And if some common sense and judgment comes into play here, if your dog is glad to see you, great. If the dog is panicking in the crate, a thing that we will recommend sometimes is you just ignore them until they settle. And then when they settle, you let them out the crate, go to the bathroom, and carry on about your day.
That works for dogs for sure. Debbie in Prairie Farm has a question that relates to cats. Let's go there. Debbie, hi.
Hi. How are you?
Good. Appreciate the call. What's on your mind?
Well, I adopted these two cats. One was like 1 year and 2 months, and he's fine. But I adopted this 6-month-old cat, and I've been having a lot of problems with him. He doesn't answer to his name. He doesn't answer to anything, kitty, kitty, or come here, or anything like that. He seems like he has glazed eyes over it, and now he's starting to pee on my son's clothes. And I've already gotten one of those plug-ins to a calming for them to be calm. And I thought it was working, but he just started doing it again, and I don't know what to do anymore. And I can't have him peeing on stuff.
And so the cats are together, or are they?
No, they're together. They're both, at the Humane Society, they put them together to make sure they got along. So they get along really well. They play a lot together. They don't cuddle. They cuddle separate places. The kitten's constantly hidden until I come home. No one sees him. None of my friends even know I have a second cat. They say I'm mine because he never comes out. So,
okay.
Yeah.
Okay, Debbie. So did you mention somewhere in your history there that his eyes seem to be glazed over? Does he seem to behave normally in the sense that he's active and engaged and oriented?
No, I mean, if I take a toy out, he'll engage in that and stuff, but he doesn't engage in anybody that comes over or anything. He stays hidden until they go, and then he'll come out. But I don't even think he makes eye contact with me. You know what I mean? He just doesn't look at me like the other cat does, and I think there's something wrong with him. His head's really small, and...
Well, and that's exactly what I'm getting at, because there are some medical issues that could be at work here. Either when you mention a 6-month-old cat that seems to be potentially neurologically different, then I would definitely want a veterinarian to take a look at him and evaluate, do a central nervous system exam to ensure everything is medically okay. And if everything is medically okay, then there's all kinds of nuance in your situation. And I'll just try and hit some of the big points. With regard to my cat doesn't necessarily come when I call. Well, I think there are some cats who come when they are called, but it's pretty common for them not to. Things that we recommend is a lot like a puppy or a dog, in which case you reward them when they come. And in order to establish that, you almost have to call them to call their name when they're already coming to you, and then reward that behavior. So that's a big, long discussion. With regard to inappropriate litter box use, some of the broad recommendations that we make are that you have at least as many litter boxes as you have cats plus one. Some of the recommendations with regard to litter boxes, easily available, scooped out every single solitary day at the least frequent unscented litter. As I said, easy access. We think cats prefer uncovered litter. And then some people feel the need to pay $900 or $1,200 for these robotic litter boxes. And I've had to reserve my judgment on them because when they first came out, I thought, man, this is going to be a disaster. But I've heard stories about how people in multi-cat households, the cats will line up like people at a concert to use the robotic litter boxes. And that surprises the heck out of me. But if you're using one of those and the cat's urinating outside of it, I would give it some thought. So kind of painting with a broad brush there. There's lots of variables in your question.
Yeah, Debbie, thank you for calling. Corey in Judah has, I think, maybe a related question. Let's go there. Hi, Corey.
Hi, Larry. Thanks for getting me on. Yes, I think it's related. So I have what I'll call a pair of grand cats. They're our daughter's cats, and she's home from college, and so she is here with her cats. And they spent the early part of their lives with us too. But now, when she goes away for the weekend, one of the cats will go beside the litter box, not in the litter box. We're keeping it clean. Seems like we're doing the same things that she does. They seem comfortable with us. Even when she's home, they spend part of the night with us in bed, part of it with her. We just cannot figure out. The only thing we can guess is the one cat that's doing that is mad because mom is gone. We just don't know what's going on.
Yeah, there certainly could be a behavioral component to that, and keeping the litter box clean is one of the first and most obvious suggestions. Hopefully you have other litter boxes in other locations. Could be a piece of the puzzle. The other thing is, even experience has taught us that even if it seems like a straight up behavioral problem, always look for the potential medical implications. We'd love to get a urine sample out of that cat, which I've had a few friends, we've had a few clients who have been clever enough to be able to freely catch a urine sample out of their cat. Most of the time that requires going to the veterinarian, where we take a urine sample from the cat by cystocentesis. But in this case, you might want to take a look at the potential medical implications, which would be a possible urinary tract infection.
Yeah, that's another good point. Corey, thank you very much for calling. You can join in too. Number to call 800-642-1234. Email us to talk@wpr.org. Looked a little at separation anxiety, but taking other questions as well. I'm Larry Mealer for WPR News. We're taking a look at your pet's health on the program today with Dr. Bill Stork, owner and operator of Lake Mills Veterinary Clinic. Great to have him with us today. So look, tomorrow it's a Wildlife Wednesday, and we'll talk with the director of the Wisconsin Office of Outdoor Recreation. So look forward to that. And the author of a new book. It's titled The Feather Detective. That's tomorrow at 11. But right now, your pet's health, and you can join in at 800-642-1234. Email to talk@wpr.org. Any link, Dr. Bill, between canine dementia in our senior dogs and maybe the development of separation anxiety?
I've never put those two things together. However, I have learned over the years in aging pets, as they approach double digits, I will ask questions in that physical exam to the effect of, have you noticed any difference in their behavior? For example, trying to go in through the outdoor, or having a hard time finding their food, staring at the ceiling fan, things like that. And interestingly enough, clients who have not necessarily brought those things up at the onset of the exam, they say, "Oh yeah, well, actually, we have seen some of those things." And it's human nature that as our dogs age, we have a tendency to shrink their world in the sense that we take shorter walks or we don't take walks, or it's more difficult for them to get in and out of the vehicle, so we don't take them to town the way we used to. And I'll circle back and try and get ahead of the situations and make the recommendation. They say about us, once a man, twice a child, and that very much holds true for our pets as well, because left to their own devices, they will get more anxious with time. And dogs who used to not have behavioral issues will develop them later on. And one of the ways to delay the onset of those behavioral changes is to keep them engaged. I mean, the parallels abound. We talk about people with dementia. Some of the ways to delay that onset, for example, is to keep hosting a radio program until the end of time. Keep people to keep physically active and mentally active, and the same thing holds true for our pets.
Terry in Wausau has something for us. Let's go there. Hi, Terry.
Hi, Larry. Yeah, I was bitten yesterday by a friend's dog. The dog had been around me that was the second day that the dog was around me. I was building a chicken tractor for my granddaughter, and this friend came over to visit with her dog. And it was on the second day that the dog, was around. And it's a 2-year-old dog that's a rescue. The owner, who is a friend, only had the dog for a couple of months. She knew the dog was not well socialized, but she was trying to work on that. But all I did, I just walked in the direction of the owner's truck. My car was near that. I was going to get some more tools. The dog, I didn't see the dog, but it came back up behind me and it bit me behind my left knee. And it got a pretty deep puncture wound. My question is, what do you think that owner should do with the dog? She's really puzzled, confused.
Yeah.
Well, Terry, in order to answer that question, I mean, there is a fair bit of information in your piece of history in the sense that the dog, you weren't approaching the dog. As a matter of fact, it sounds like you were walking away from the dog and maybe in the direction of your friend's vehicle. So we could stretch that out and say maybe the dog was resource guarding her vehicle. But that's a really significant behavior that you were not approaching the dog and the dog came up behind you and bit you. In order to answer that question, and we don't have enough variables, we don't know the dog's situation, we need to know where that dog lives, what its family looks like, who are the people coming and going in its world, and how it reacts to them. So hopefully they have a veterinarian in their area that is dialed into behavioral issues. And in Wausau, I bet you do. There's got to be those resources up there. But the short answer to the question is that your friend has to live in awareness that this is always a possibility. And your friend with this dog who she's had for a couple of months has to ask herself, can she manage, can she police every potential human interaction? And that means the dog is never on a leash. And boy, I really hope there's not like a choke collar or a pinch collar involved, because those are the kinds of things that can escalate the situation. It could be tempting for her, to use one of those to prevent the dog from pulling, it could escalate the situation. She needs some expertise in this situation.
And if your vet does not have that kind of experience, there are certified applied animal behaviorists. I think who the vets, your vet probably knows those in your neighborhood or in Wausau that could help with that. I would think, wouldn't you, Bill?
Yes, Terry, and always ensure that when you're seeking out behavioral expertise, the first question you need to ask is, are they reward based? Because if when they get out of the vehicle, they're looking to put that dog in a shock collar, that's going to make the situation worse.
Yeah. Terry, there you go. Thank you so much for calling. Appreciate your call. You can join in too. Number to call 800-642-1234, or you could email to talk@wpr.org. Give a call, shoot an email. We'll get you on pretty quickly here. Amy emailed with advice on collecting a cat urine sample. Amy says, place styrofoam peanuts in the litter box, not the dissolving kind. When the cat uses the box, the urine is not absorbed. Collect the urine using a syringe or a turkey baster. Amy's done this a few times and has offered the advice to others who have had success with it.
A clearly marked turkey baster, as it were. We've also had clients who have been stealth enough that they can put a ladle on the end of a stick, and their cats are predictable enough that they can sneak it underneath them and catch a freely caught sample.
Somebody else is wondering about breeds. Is there a difference among breeds of dogs when it comes to separation anxiety or the kind of behavior that our earlier caller talked about?
Well, not so much separation anxiety specifically, but I will use that opportunity as a segue to say that, if you live on the second floor of an apartment and you work 8 to 10-hour days, please don't get a border collie or a blue heeler. Think in terms of, there are certainly breed tendencies. There are certain breeds that require jobs, and border collies and blue heelers are the perfect example of dogs that are used to working.
Yeah, absolutely. Tony in Bowler has a question or comment. Let's go there. Hi, Tony.
Hello. We have a West Highland Terrier, a male. He's been neutered, and when we leave him in the house, when we leave for maybe an hour or two to go shopping, he will find something to chew, and he'll chew it up. It'll be a flip-flop or my couch pillow, anything he can find, he'll chew. He doesn't do that when we're there. So I'm wondering, is this
how old
an
is he?
anxiety issue? He's less than a year old.
All right, Tony. Well, 101 reasons why we always recommend the use of crates on the front end when people bring a dog home, because we're looking to save them from themselves, beyond the value of your house slipper. Those are the kind of things that could potentially become obstructive foreign bodies for them. The things that we would recommend in a situation like that is possibly a crate if at or near a year of age, if they've never been in a crate, or if it's been a very long time since they've been in a crate. If you put them in there, then we're okay if they bark, if they complain. We're not okay if they escalate and they panic. Then it is not becoming a positive situation, in which case we back off, and we'll recommend that people use, if you have a bathroom, if you have a laundry room, if you have a gated area, that you can save them from themselves. And then, of course, give them something that is more of your choice for them to chew, whether that be a bully stick or a nylabone or safe things for them to chew on. If your dog, your Westie is probably not going to chew off a large hunk of a rawhide, but we usually don't recommend unsupervised rawhide chewing.
There you go, Tony. Thank you so much for calling. Appreciate your call. Let's take another call. This one from Julie in Madison. Hi, Julie. Thank you for calling.
Hi. My dog, who's about 13 years old, a couple of months ago was diagnosed what the vet thought was old dog vestibular syndrome. She was real wobbly, couldn't stand her eye. She had nystagmus in her eyes, wasn't eating. We did symptom management, things like that, and she recovered. But I guess I'm wondering, is this something that might happen to her again, or is this kind of like a one and done thing?
Well, first of all, Julie in Madison, thank goodness that your dog recovered, because frequently when they develop the head tilt, circling, ataxia, falling to one side, and especially the nystagmus, it's much more common for them not to recover from that. So the answer is, yeah, it could happen again, because that old dog vestibular syndrome is a neurologic symptom, a neurologic condition that could be at its root as a result of what we called roughly something bad inside when we were in school. And that something bad inside could be, God forbid, it could be a tumor, it could be a mass, it could be a vascular incident that took place. So, as your veterinarian recommended, you manage the environment, you keep them engaged, and you make sure they're safe at all times. So great that you recovered the first time.
Yeah, absolutely. Julie, there you go. Thank you so much for calling. Let's go to Perry in Ocado. Hi, Perry.
Hello, and thanks for being there, Doc. My question is dogs and swimming. You got this time of year especially. My dogs swim almost year-round. Cold doesn't seem to bother them. But what should we do for precautions? And my dog is a Springer Spaniel, so we trim the back of the ear, try to get the hair out and stuff like that. And I know there's some products with drying agents. How often should you use those? And is there a do-it-yourself mixture you could do?
Yeah, Perry, first of all, awesome that your dogs, evidently you've got the canine version of Wim Hof, which is awesome. Your dog will probably live forever swimming in that cold water. And you're correct. The biggest things with regard to, you mentioned spaniels, they've got those feathers, and if it's been going on for a while, evidently they're not getting hot spots from being perpetually wet. Drying the ears out physically, with cotton balls, with 4x4s. And then there are astringent solutions out there that have like a little bit of propylene glycol in them that will help dry those ears out. But hopefully centrifugal force works. They climb out of the lake and they shake their head, and hopefully gravity will get a lot of the water out of their ears. But man, love that your dogs get in the water that frequently. Just another precaution is, of course, with small bodies of stagnant water, because this is the blue-green algae time of year. And blue-green algae does not have to be blue. It does not have to be green. It does not even have to be seen. And it is one of the most wicked, mean, and nasty toxicoses that we don't see them because those animals don't come out of the water. That's how quickly they are affected. So, if you have a woods, if you have a pond that is stagnant, be super cautious of that. But moving water, larger bodies of water, you're just fine.
Perry mentioned drying agents, and to be honest, I don't know anything about drying agents. What I guess they help the animal dry, but what are those agents, and is there a home remedy or prescription for that?
We're speaking specifically about the ears in this situation, and there's products for dogs that are an astringent or like swimmer's ear, and swimmer's ear has, as I said, something like propylene glycol in it, which will help help dry the ears out, because we're always living in fear of ear infections.
Cindy emails. She says she's been able to easily collect cat urine by sliding a metal jar lid under the cat while it's peeing in the litter box, and it works very well.
Well, clearly Cindy's cat does not have stage fright. That's pretty cool.
I think so as well. Oh, could certain life events, maybe the death of another pet, trigger something like separation anxiety?
Oh, you bet. That's the perfect question. And man, we have seen some dogs and cats that when they lose their mate, whether it be another dog or cat or a person, that seem to carry on without a hitch. And we have seen others, well, you can call it, sounds a little bit anthropomorphic to call it mourning, but I don't know another term for it. But yes, that absolutely can be the case. And when we know that time is coming, as we kind of expand on that thought, a really great opportunity to reinforce our engagement with the pet left behind. And whether that be, if it's a cat that likes to groom, if it's a cat that likes to chase a feather or a glitter ball, whatever the case may be, if it's a dog that likes to go for walks, ensure that you continue to engage the pet that's in danger of being left behind.
Yeah, I think so as well. July 4th, with the fireworks, I'm noticing that there are fireworks going on in my neighborhood, or at least close to my neighborhood, right through the summer. It usually starts a couple of weeks before July 4th and then continues on for many months thereafter. I would expect that exposure to loud noises could have an impact on separation anxiety as well.
Well, or it can just create its own fear and its own anxiety. And we clearly answer those questions this time of year very frequently. And yes, we have pharmaceutical interventions that can help. But if somebody is shooting fireworks off in our neighborhood on Tuesday, July the 22nd, what the heck are we supposed to do about that? And some of the things that we recommend to people is that anxiety can be contagious. We know that among people, we know that among pets, and your reaction is going to be mimicked in their reaction. So the less you react, the less they will react. And, if they have activities that will assuage them, like chewing on things, then that's a really good opportunity. If they have a place that they will go, like in a crate in the basement, a bathtub behind the toilet, and if they go to that spot and they relatively settle, then that's a really excellent piece of management for those situations.
Dr. Bill Stork, our guest today, owner and operator of the Lake Mills Veterinary Clinic. Something going on with your pet? Maybe a visit to the vet is in order? Well, you can get some advice right now from our guest, Dr. Bill Stork, owner and operator of Lake Mills Veterinary Clinic. Give us a call. The number is 800-642-1234, 1-800-642-1234. Email to talk@wpr.org. I'm Larry Mealer for WPR News. taking a look at your pet's health on the program today. And just a note that later on in our second segment of the show, at the bottom of the hour, we'll check in with the director of the Wisconsin Academy for Graduate Service Dogs, or WAGs. They'll talk about service animals. And right now we're talking about your pet's health with our guest, Dr. Bill Stork, owner and operator of Lake Mills Veterinary Clinic. You can join in at 800-642-1234. Email to talk@wpr.org. Let's take a call from Ingrid in Eagle River. Ingrid, hi. Thank you for calling.
Hi, I'm glad I got on. I was listening to your show and talking about pets' anxiety, dogs in particular, to fireworks and thunder. So I had to pull over and call. And my dog, Holly, who's now a 12-year-old chocolate lab, used to really get upset by fireworks and thunder and whimper and whine and carry on. So what I started doing was watching the forecast for thunderstorms, and the minute a distant thunder would occur, I would reinforce her and I would say, "Oh, yay, a thunderstorm! Let's go and listen to some calm music, and maybe some more thunder will occur." And now she rarely gets upset by any thunder. And fireworks are more unpredictable, of course, but on our lake, it's all the time. And so late at night, then I when the fireworks are going to be starting, I do the same thing, and it seems to work.
All right. Ingrid, thank you.
You know what, Ingrid, that is perfect and that is brilliant, and I will use that example forever in the exam room, because what you did is you classically trained, classically conditioned your lab. That is the perfect solution. Nicely done.
Thank you, Ingrid. Appreciate you stopping the car and joining in. Appreciate it very much. Patty in Eau Claire, we'll give you a chance to join in. Hi, Patty.
Hello. Thanks for taking my call. I'm just going to put this out there. I might have to drop off. I'm in my car, too. We have in our life an Australian Shepherd, and love this dog, love the energy. A neutered male, he's 5, and it's actually my daughter dates someone, a significant other. It's his dog, but we spend a lot of time with them and with the dog, and we live in the country. But this dog is reactive to, it seems to be children, people on bikes, and basically when it meets other dogs on a walk, does really well off leash, in hiking trails and such. It's an Aussie. He likes to make sure he's always near his people. But just wondering what we can do to help not be reactive in situations when we might have family or friends coming over and we just don't want to put him in a bad spot. What kind of training might help? Again, he's 5. Grew up as a puppy being exposed to other college-age kids, didn't ever have any problems. But the older he gets, the more reactive he seems to be. Thank you.
Yeah.
Yeah, and first of all, love those dogs. Had an Australian Shepherd Blue Heeler cross for 15 years, and that hole remains. So kids are the top of the list because they're unpredictable in their movements, and of course, there's nothing more tempting than a bike rider riding by. And the answer to the question is patience, persistence, and repetitions is what it's going to require, so that if this dog is nervous around kids and if this dog runs after bicycles, then what you have to do is get on the front end of the situation, and with the dog on a leash, of course, we never want those kids to be able to have the option to approach that dog, because it's really hard to coach kids on not coming at the dog with their hands raised high. But what we try and do is kind of getting back to Ingrid. What Ingrid did with her dog and thunderstorms, you treat the dogs. If there are kids that are old enough that you can coach them up on tossing treats from the kids to the dog. We don't want, if we can't trust the dog, we don't want the dog reaching the kids reaching their hand towards the dog, but for the kids to toss the treats to the dogs so that he becomes positively associated with kids. And then that's kind of you work from that point forward, but you always ensure that you have control of the situation by having the dog on a leash.
Yeah. And I guess for other dogs, spotting the other dog approaching and doing the treat issue would work as well.
Yeah, you have to know, and you have an Australian Shepherd that's 5 years old. It's hard to notice things before they do because it's their nature. But, we're doing this with one of our dogs at home right now because he will chase bicycles. Well, I am the bike rider on occasion. So what we try and do is my wife will know that I'm coming. She'll get his attention, have him sit, and call him back, and so that he doesn't chase bike riders. Dangerous for the dog and the bike rider.
Yeah, it is indeed. And sometimes you need to do that over and over again and sort of set up situations for it to actually over time work, I would think.
Oh, absolutely. It takes multiple repetitions, and you may never get that dog so that it is absolutely bomb-proof and fully trustworthy around kids.
We've got Nick in Green Bay next. Nick, hello. Thank you for calling.
Hey, I've got a kind of a little bit longer question here. Up until Saturday, we had 4 pets. We had 2 cats and 2 dogs. We had a 14-year-old cat, and we decided to adopt a cat from the Humane Society like 10 days ago because we knew the 14-year-old she's old. Well, Saturday we woke up and she couldn't use her hind legs, and it just slowly decreased to her whole body, and 7 o'clock she passed away. But the black cat that we adopted 10 days ago, it refused to come upstairs while that white cat was alive. Once it passed away, the black cat came upstairs with the dogs and stuff, and it's kind of tolerating the dogs and stuff. But my question for you is, how do we know when the cat is actually fully comfortable with the 2 dogs? Because I've got I call all labs dorks. My black lab, he's a dork. And so I was just wondering how you know she's comfortable with the dorks and stuff.
Yeah.
Well, affectionately speaking, a dork, of course, because labs are among my favorite breeds, but I couldn't agree with you more. And the answer is, we always give the cats the option to retreat. And it sounds as if the cat is coming upstairs and approaching the dogs, then it sounds as if the cat is approaching, being comfortable with the dogs. And then, of course, we look at the dog's body language as well. And, are their ears relaxed? Is their respiration calm? Are they looking to turn away from the cats? Because I wouldn't just be thinking about, is the cat comfortable around the dog? I would be worried about, is the dog comfortable with the cat around them? And if the dork isn't reacting, if the dork is remaining calm, then it sounds like you're doing fine. And if in doubt, like when you're gone, especially in these initial days when everybody's getting acquainted with one another, you may want to create some separation with a gate or something like that so that nothing bad happens when you're gone.
Yeah. I also thought it was kind of interesting that the cat stayed with the other cat while it was passing and didn't go anywhere until the cat died.
Yeah, that's not unusual. And even, as our behaviorist says, dogs are territorial, but cats wrote the book. And we just saw a pretty common example of that.
Elise emailed. She wants to know how to stop a young rescue dog from eating its own poop and from biting others. It's a small dog, about 9 pounds and about 9 months old.
Oh, can I plead the fifth on this, Elise? That age-old question with how do we prevent dogs from eating other dogs' stools? And man, there's all kinds of suggestions out there, ranging from peppermint. There are commercial products called Forbid that you feed to the dog whose stool is being eaten that are supposed to, and I love this, make the stool less tasteful, as if stool isn't distasteful enough. But evidently, some dogs just seem bent on consuming either their stool or other dog stools. And the short answer is, and as simplistic as it may be, that you just have to pick it up. And you can, in some situations, once you get everything else under control, and if you have a 9-pound rescue dog, there's lots of behavioral issues to be working on, but you can establish a real solid leave it. But that takes time and repetition, as we've talked about during this show. With regard to the biting, that's going to be a big one, and kind of like back to the Australian Shepherd that's not quite trustworthy around kids. If you have a dog that likes to jump up and bite people in the ankles, then it requires a leash and control. And if it's biting people in the ankles, it can't have access to those people and has to be rewarded when it's not. So that one's going to take a while as well, time and repetition.
Blake in Sun Prairie, it's your turn. Hi, Blake.
Hey, how's it going today?
Good. Appreciate the call. What's on your mind?
Yeah, so we have a Siberian kitten. He's just about a year old. And our breeder had informed us not to really ever let him go outside. But we did. He got out, and now he demonstrates extreme desire to go outside. And when he doesn't seem to get his way, he seems to almost passive-aggressively pee outside of the box. So he's already ruined one couch. We have let him start to go into the garage, which seems to be helping, but wondering if there's anything else we should be trying. We got those pheromone like plugins, which seem to help for a little bit. But yeah, that's what we're dealing with our cat.
All right, Blake. Well, we may end up bumping up against the news break on this one, but you've kind of got a couple of different situations there, because inappropriate urination has to be treated like inappropriate urination, and it may not be only because he had an opportunity to go outside. In this situation, especially with a, air quotes, purebred cat, then I think you need to figure out a way that he can get exposed to the outside. And there are enclosures that you can get, like a previous caller talked about a chicken tractor. You can get a cat tractor, in which case it's like a mobile enclosure whereby the cat can be outside and it can smell the outdoors and it can be in the grass and things like that. Larry's making motions over here.
Yeah. I tell you what, we can continue this conversation, Blake. So you guys stay listening. We'll finish up. Dr. Bill will finish up, not me. Dr. Bill will do that right after we take a look at the news. I'm Larry Mealer. It's a pet care day, a pet health day on the program. Larry Mealer here. Great to have you along today with our guest, Dr. Bill Stork, owner and operator of Lake Mills Veterinary Clinic. He works with both small and large animals. We've started by talking about separation anxiety, but of course we've gotten into all kinds of health issues, and you can join in. You have a health question regarding your pet, give a call at 800-642-1234. Email to talk@wpr.org. And just before the break, Dr. Bill, we were talking with Blake from Sun Prairie. Cat was peeing outside the box since he had been let outside for the first time, and you were responding to that and maybe offering an opportunity for the cat to spend more time outside.
Yeah, and when cats are urinating outside of the litter box, we go at those situations from every conceivable angle that could help. And your first move with regard to the Feel Away diffusers is super solid. Great thing to do. Don't let those expire. Inside the house, kind of the standard package of recommendations that we talked about earlier, which is multiple litter boxes that are scooped out every day with no foreign odors, unscented litter, etc., and in multiple locations within the house can help you out. And then, these have a tendency to be pretty intense cats, these Siberians and things like that. So it may be such a thing that you need to provide him access to the outdoors, whether that be contained, like in one of our technicians once upon a time had kind of like a cat tractor that she could move to different locations around the yard. We have had clients that have gone so far as to enclose a gazebo outside their house. We had a client that built an enclosed tunnel from their sunroom to a gazebo that they had made into a remote, essentially cat-proof house in their yard. Or, depending on your appetite for adversity, some people will allow them access to the outside. The last appointment that I saw this morning is a cat that used to be a feral cat, an outdoor cat, and the cat goes with the family in the yard, and if they're gardening, the cat is gardening. But of course, you run the risk, and it's pretty unnerving, you run the risk that the cat may not stick around. So
yeah.
There's
that.
That will take all resources.
Ryan in Loganville has kind of perhaps an opposite question. Let's go there. Hi, Ryan.
Oh, hello. Thanks for having me. I actually do have quite the opposite situation. So the situation I have is I have a American Shorthair cat that used to love to go outside with me. I had her harness trained and everything. We would spend 4 or 5 hours outside every single day. But now this summer, it seems everything has flipped, and she hates going outside. When I open the door, she runs or hides behind the couch. When I pull out the harness, she tries and gets away from me, and it's just, oddly, it's just such a Uno reverse that I don't know what happened. I was wondering if maybe you had an explanation.
Mm-hmm.
How old is she, Ryan?
She just turned 4 last week.
Okay. Yeah, my speculation is that she smelled, heard, saw, or perceived something out there that has her spooked. And whether that be another cat in the neighborhood, a dog, a coyote, a raccoon, who knows what, but I feel as if she has perceived some form of danger. And, cats have a sense of smell that are hundreds of times more sensitive than ours. And something triggered the alarm for her. And, if that is the case, she may or may not warm back up to going going outside, which will be really unfortunate because it's really awesome. I love it when people have cats that are able to go outside safely. So, what I would do is going forward is just give her the opportunity. And if she wants to take one step outside and go back in, that's great. If she doesn't want any part of it, what we do know is and you know this, of course, is to try and force it on her will only make the situation worse. But no, I hope she gets back to going outside. That sounds like an awesome arrangement.
Yeah, maybe treats would help with getting her back used to putting that harness on as well.
Positively.
Dave in Lake Tomahawk, your turn. Hi, Dave.
Hi, thanks for taking my call. I have 3 Siberian Huskies. They're all neutered or spayed. 1 female, 2 males. The 2 males are 11, and the female is 4. One of the males, if we leave him alone all day long with the other 2 dogs, he'll rip up the carpet or attack the curtains or whatever. And we're just beside ourselves with him. I mean, we love him to death, but we don't want to kill him,
Yeah.
So, anyway,
and
that's my problem.
Dave, did you say he's 11 years old?
Yeah, he is.
And he's normally with the other 2 dogs, but if they have to be split off, then he does the behavior that you're describing.
Well, even when he's with them, they're all 3 together. The other 2 are calm and nice. We're on vacation right now. I'm from Bluegrass, Iowa, so I boarded him while we're up here in Wisconsin. The other 2 are at home with my son, and he works all day. So, we just didn't want to risk it. But he's kind of a nervous guy, and he, he won't. You try to call him, he just stands and looks at you. So he's just been weird his whole life.
So he's been strange his whole life, but as of lately, the situation has escalated and gotten dramatically worse, correct?
Yes.
Okay.
Man, as you may very well know, you're swimming upstream, and the likelihood of being able to absolutely solve this problem is not great. And a thing that comes into play is to ensure that cognitively he's with it. I mean, and you say that he's been a little bit strange forever. The things that you might be able to do to help this behavior is to engage him. If he'll walk, take him for walks. If he'll play with him, whatever you can do to engage him. This one might also be a situation where pharmaceutical intervention can help. We have some situational anti-anxiety medications that can help with these situations. It's a bit optimistic to think that it could solve it.
Dave, good luck. Thank you very much for calling. Let's go to Dave in Bowler. Dave, hello.
Hello. I have a 18-month-old Great Pyrenees mix, and last Wednesday night, in the middle of the night, when he got up to go outside, his front left leg was very lame. Couldn't really put weight on it, and gave him a little break, and it seemed to bounce back and went away, and then it came back, went away, and then came back. And now after the weekend, I really kept him from running around or moving at all. And now it's gotten worse. This morning he was a bit lethargic when we went to go do our drive around the area and take a look at some deer, which is normally very excited to go do. And and I'm just thinking it may be Lyme related.
Hmm. Yeah, my thoughts as well. And when you were talking about distinctly one leg that seems to be waxing and waning in an 18-month-old giant breed dog, there's a condition called OCD, osteochondritis dissecans, in which case they develop a really distinct growth on the head of their humerus, and it can behave like you just described, and that would be a diagnosis that would be made based on an x-ray. Then when you incorporated that he is also being lethargic, then absolutely Lyme disease is, here we are in the Midwest, especially in Wisconsin, that has to be a consideration. And in the lethargic and limping dog, a rectal temperature is going to be a very interesting measurement. And I bet when you get to your veterinarian, one of the first things that they'll do is test him for Lyme disease. We can test for that quite handily in the office.
Dave, get to the vet with your dog. That's the statement here for you. Thank you very much for calling. Cheryl in Berlin, we'll go to you. Hi, Cheryl. Cheryl, are you there? Okay, let's take a call from Ron in Beulah, Michigan. Ron, hello.
Hi, thank you. I talked to Dr. Stork a year ago about my dog. Was 13 and a half, now she's 14 and a half, a black lab, retired guide dog. And she had arthritis getting quite bad, and we put her on the Librela shots, which has kept her going happily an extra year. She also has kidney disease, though, and that's gone from stage 2 to stage 3, even with Royal Cane and really renal support food. Her teeth are getting quite bad with bad breath and some gum disease. I wanted to have them cleaned a year ago, but the vet did not want to do it because they said the anesthesia would be harder, and she's always been kind of sensitive to that. I'm just wondering what I can do. It's been 2 years now since her teeth have been cleaned, and I'm expecting they're going to get bad. Is there anything I can do?
Yeah, there's a few recommendations there, Ron. First of all, awesome that the Librela is helping. Second of all, with kidney disease, that can sometimes be the beginning of the end. And it sounds like with the help of the prescription diets, you're doing pretty well. At this stage of the game, I haven't seen the teeth, but it probably does not make sense to do a dental. But you may ask your veterinarian. A thing that we will sometimes do is called pulse therapy, in which case what's really the danger with regard to dental disease is infected tooth roots. And sometimes we will put them on a meaningful course of antibiotics, say, for example, 10 days every 6 weeks. And if your veterinarian feels as if there might be abscessed tooth roots, infected teeth, then that can help dial that back and give them some relief for a period of time. And this is the period in life where, as Warren Zevon once famously said, we enjoy every sandwich.
Ron, thank you very much for calling. Cheryl in Berlin is back. Let's go there now. Hi, Cheryl.
Yes, I had a cat that was urinating all over too, and my husband put in a cat door with a small fenced-in area around it, and that solved it.
Yeah, yeah, Cheryl, that's a super good point. And if, if the previous caller is up for it, they make cat-proof fences. Our neighbor here at the clinic has her entire backyard fenced off, and it's a little bit labor intense to get them installed, but compared to the loss of a couch, it may be a reasonable price to pay.
Yeah,
That's a
absolutely.
great point, Cheryl. Thank you very much.
Yeah, thank you very much for calling. And just another point on ticks. We're now finding ticks in lawn areas, even in short grass. We always the recommendation was always for, if you've got long grass, cut it down. But now they're apparently turning up in even lawn situations. So that's, if you have your cat or out, make sure you're checking for ticks.
Yeah, and another meaningful statistic is that 25% of our ticks are Lyme positive. So worth living in, not in fear, but in awareness at least.
Yeah. Renee in Oshkosh, thank you for calling.
Hi, I'm calling because I have an 11-year-old Aussie. He's a male, and recently he's been having issues when he wakes up to go outside to go potty. He's been stumbling and falling over, and he's conscious of what is happening, and he knows where he's going and what he's doing, but he gets really embarrassed and he can't walk, and it usually lasts a couple minutes, and it's happened twice now in the last month. So I don't know why it's happening.
Yeah.
So, Renee, is it all four paws that knuckle over?
Sometimes he kind of stumbles one way or the other, but it's kind of like he doesn't have control of his legs at all, and he'll fall over or like kind of flat on his butt.
Yeah.
Yeah, and how long does it seem to take him to recover? And when he does he recover all of a sudden, or is it more gradual?
He recovers like within 5 minutes, and he's pretty much good right away. Like he doesn't have to like work it out. He comes in and lays down, and then the next time he gets up, he's good. He's running around like normal.
Okay. Yeah, that sounds like it could be a central neurologic event, and we're going to be super careful not to make a diagnosis over the telephone by way of the radio. But seizure type events, and that's a seizure type event in a very broad sense, can manifest in a number of different ways. And for it to come on, for him, the $10 term is ataxic, where he's fallen to one side, and then recover completely within a few minutes, that very well may be taking place. So a few things that we'll recommend are, man, if you can get a video of that, that can be extremely valuable to your veterinarian. And the other thing that we ask people to do is log it and keep track of how frequently it takes place, how long it lasts, and put that together with the video. And we can really come to make sense out of that. And as they say, there's even an app for that to help you keep track of those things.
Good luck, Renee. All the video talk reminds me about virtual care, because some vet clinics are now offering virtual care or training. What common concerns can be handled virtually, do you think, Dr. Bill?
Yeah, there's a number of things and that can come to look like a number of different things. I mean, there are straight up virtual veterinary visits, the way there are straight up virtual visits with a physician, where, essentially the physical exam and the history are collected, face to face in a video call. And, there are some common conditions that we can assess in that way. And an example of things that we can handle that way would be skin conditions that are ongoing. As veterinarians, and I think I probably speak for physicians as well, we like to put our hands on things. But we put our hands on things, noses on things. We like to be in the presence of our patients whenever that's humanly possible. There are times when the nature of the situation, whether that be the dog's personality or mutual schedules when that's not possible. So, especially if we have a relationship with the animal, a familiarity with the situation, then we can guide treatment, or especially follow-ups and rechecks have a tendency to lend themselves well to virtual. We see a lot of pictures, a lot of videos, a lot of emails. As soon as we hang up with this meeting, that's exactly what I'll be doing, is looking at videos, pictures, and answering emails.
Mark in Wisconsin Dells has something for us. Hi, Mark.
Hi, Larry. Thanks for taking the call. I wanted to share my experiences with eliminating dog and cat urine odors from fabrics. My first experience was having a small dog that got old and started having problems and left spots all over our living room carpet. We didn't discover it for a long time. At that time, I bought some odor eliminator from a lady who's she and her husband used to make the stuff and sell it to hospitals as odor eliminator. And I poured it heavily on each of these spots that I discovered with my nose. And then after about 5 hours, I sucked it up with a Bissell carpet cleaner and poured that down the toilet. And then after it dried, the odor was completely 100% gone. It was like magic.
Wow.
And you need to find those people and encourage them to patent that formula, because there's plenty of commercially available products that cannot claim that kind of success.
Yeah, that's for sure, Mark. Thank you very much for calling. Let us know if you find that person, and we'll find the name of their product if they're still making it, and let us know the next time Dr. Bill's on the air.
We'll find a chemical engineer and reverse engineer
it. Dr. Bill Stork, our guest. Thank you so much, Bill, and we'll look forward to your next visit. Appreciate it very much. Dr. Bill Stork is owner and operator of the Lake Mills Veterinary Clinic. Coming up, we're going to take a look at service dogs and issues surrounding them. I'm Larry Mealer. Great to have you listening in on WPR News. Larry Mealer here. You know, most pet owners would probably say they have a special bond with their animals, but service animals and their handlers have a very unique partnership, I think we could say. Service animals are highly trained. They offer safety, independence, and support for their people that can be life-changing and life-saving. And we'll look at service dogs, maybe take a look at the differences between a service dog and a therapy dog, and also what rights these dogs and their owners have with our guest, Aaron Becker, in the studio with me for the next half hour. He has been the executive director of the Wisconsin Academy for Graduate Service Dogs, or WAGS for short. WAGS works to improve the quality of life for people with physical challenges through the use of highly skilled service dogs. So do you think your dog might be a good service animal? Maybe or someone you know has benefited from having a service dog? Join the conversation. Give a call. The number is 800-642-1234, or you could send an email to talk@wpr.org. And Aaron Becker, thank you so much for joining us today. Really appreciate it.
Yeah, thank you for having me. I really like the way that you called it a partnership. That's what we call it as well.
Maybe to start, just explain the difference between a service dog and a therapy, what's called or known as a therapy dog.
Yeah, so service dogs go through quite a bit of training. For example, our dogs train for at least 2 years from the time they're about 8 weeks old, And then they go through maturity, and about 2 or so, they're ready to be placed and start training with their person. They go through a lot of different training, developing skills, but we're also watching for their behaviors. We're always trying to positively shape their behaviors and find out if that dog after 2 years is going to be a good service dog to help a person stay safe, increase their independence, and all of those things that you said. Therapy dogs typically are nowhere near that much training. We have the Canine Good Citizen, which is a test that therapy dogs are given to be able to go into places like nursing homes and provide comfort and therapy for people. And so it's basically the amount of training and being in public places and making sure that they're appropriate.
So what kind of other abilities can a serviced animal assist with?
Well, we specifically train mobility assist service dogs, and they're routinely placed with people in wheelchairs. So our dogs learn things like picking up items from the floor and putting them right in the person's hand, getting things that are out of reach, opening doors either with buttons, pushing buttons with their noses, or using ropes. Like every person that has one of our service dogs has a rope on their refrigerator door, and that dog can whip the door open and get just about anything you want, unless it's in the deli tray or something.
It's an amazing ability. Are there breeds that are better at it than others?
For us, for sure. Right now, the only dogs that we're using are golden retrievers, and mainly because they have really nice temperaments. They're very friendly, so if you encounter a golden that's a service dog in public, it's going to be very friendly. They have the right size to get up on counters and pull open heavy doors and things like that. And so we used to also train yellow and black labs. We would still be doing that. We just struggle to find breeders that are still breeding for temperament for yellow and black labs.
So let's talk more about the work that goes into the training, because 2 years.
Yeah. It's a long time, and we make sure to start them so young at 8 weeks, so that right from the beginning they realize that they're being trained to do something special. Our dogs are not allowed to be part of a pack. So none of our trainers have 3 or 4 dogs at home, because being part of a pack and playing all the time is probably more fun than training to be a service dog. But the benefit is when they become a service dog, and while they're in training, they get to go everywhere with their person. They're almost never left home, and just imagine the things that they experience and the things that they see.
It's amazing to me. So the traits of a good service dog are.
So we go to breeders that are breeding for temperament, and a good temperament is a dog that is calm, that can overcome stress and anxiety in new or different situations, and even can go into a place like a grocery store and have confidence. Walk around with its head held high, tail wagging, not a problem in the world. But they also always have to be on call as well. If they need that dog to do something right now, right away, they have to be able to do that.
And they're usually, maybe it's always, they're somehow identified with in some fashion, are they not?
Yeah, most organizations will make sure that their service dogs have a vest on. If you see a blue vest, that's a dog that's in training. If you see a red vest, that's a dog that's already been trained and placed with their person. And you may even see a green vest. A green vest is for a therapy dog.
Christina in Glenwood City has something for us. Let's go there. Hi, Christina.
Hi there. Thank you. I have a friend who has a very well-trained service dog. They've been together for 3 years. They go everywhere together. The dog has seen everything. And recently, they were at a local pony fair, and somebody came up to her and said that she and her dog cannot go into any of the area of the animal areas or barns, even though it's been trained to that and has gone in the past, for the past 3 years, actually.
Mm-hmm.
And so I'm just curious about that.
Well, that's unfortunate, because a trained service dog that's working with a person with a disability and has skills directly related to that person's disability can absolutely go in those places. It sounds like maybe the person that told them they couldn't do that was misinformed or was worried about something they maybe shouldn't have been worried about, because these dogs can handle situations like that, especially if they've been there before.
What would you do in a situation like that? I mean, maybe at the time you don't do anything, but but there should be some education there.
Yeah, I mean, if there was one thing that I would wish for is that there could be more education. Service dogs technically don't even have to wear a vest, like I talked about earlier. Now, it's always good for your service dog to have a vest and maybe a patch on there that shows where it was trained. We put our WAGS patch on all of our dogs so that if there's ever a problem or if you see something that doesn't look right, you can give WAGS a call and we'll try to figure that out. But, it's hard. Say a dog goes into a grocery store and it's barking at people, it's taking things off shelves, it's bothering people. That's probably not a service dog, but the person may not have the information to be able to distinguish or which questions to ask the person. And in fact, there are only two you can ask. Is that your service dog, and what has that dog been trained to do for you? And if that person can give good answers to both of those, then they have to assume that that's a service dog.
Our guest today, it's great to have Aaron Backer with us, Executive Director of WAGS. He's worked in leadership positions at nonprofit organizations and ones that work directly with children, youth, and families for more than 20 years, and serves as on the Dane County Youth Commission as well. So it's great to have him with us. Questions for him, you can give a call. The number's 800-642-1234. Email to talk@wpr.org. And if you own a service dog or have questions about them, I hope you'll join in. I'm Larry Mealer for WPR News. Taking a look at service dogs, how they are trained, what are the regulations and rules regarding them, with our guest Aaron Backer, who is Executive Director of WAGS and has worked in this area for a long, long time. It's great to have him with us. And again, you can join us at 800-642-1234. Email to talk@wpr.org. And let's take a call. Mike in Platteville has a question for us. Mike, thanks for joining in. What's on your mind?
Yeah, I was wondering if your guests could talk about the difference between service dogs and therapy dogs when it comes to Wisconsin landlord-tenant rights and some of the issues that come up from that, especially when it comes from landlords' understanding, and then more importantly, the public understanding, the generalities of, some people like to try to take advantage of those situations and the correct questions to ask.
Sure. So emotional support dogs, which is a new class of dogs probably in the last 10 years or less. And there's a lot of confusion between service dogs and emotional support dogs. Emotional support dogs, if we're talking about a right or rights, the only area where they have rights is in housing. And so there was legislation many years ago that allowed emotional support dogs to be with their person in leases or apartments, places like that, where there was no dog policies. Now, emotional support dogs are not allowed to be in public places like service dogs are. Reason being, many times they don't have the training that service dogs do. Emotional support dogs typically only provide comfort. So you can have your emotional support dog in housing in places where there's no dog policies, but they are not service dogs. They're very different. And I know that there's recently been some legislation forwarded, it hasn't been passed to my knowledge, that is going to try to clarify emotional support dogs as dogs where you get a prescription from your doctor, and that is something that you will need if you want your emotional support dog to be with you in housing, especially in places that have no dog policies. Now, a service dog, they can be with you no matter where you get a lease or buy your home or anything like that. They can go into public places, literally anywhere, and so two very different things.
Yeah, and when it comes to, and I think there have been some people who have taken advantage on the emotional support dogs.
Mm-hmm. Yeah, it blurs the lines between what's a service dog and what is not a service dog. Many people love to take their dogs with them wherever they go, and I totally get that. It's a wonderful thing to be able to do that, but it really is a right that is restricted to people with disabilities and their trained animal, their trained dog. There's therapy dogs. You can get the Canine Good Citizen, and you can take your dog to a senior assisted living or a senior care home or something like that, and provide comfort for people. And that's a nice thing, but you can't take that dog into a restaurant if you want to go out to eat later. That's something that's a right given to people with disabilities. And we don't, one of the things we've always been concerned about is either a dog that's in training for us or other organizations, or a dog that's already been placed. Bringing your pet or emotional support dog into a place could distract them from doing their work or their training. But worse yet, dogs that haven't trained in public places for a good amount of time, they can get stressed, they can have anxiety, and those are conditions for sometimes dogs will bite or lash out because they're anxious or they're stressed out, and so it can be dangerous.
I'm wondering about the people who train now for WAGs. You've got trainers. How were they trained and so forth?
I'm glad you asked that, because I wouldn't be able to get out of here without talking about our volunteers. So WAGs is mostly a volunteer organization, and all of our volunteer trainers are volunteers. We look for people that love dogs, but they also have to have this other trait, which is they want to do something really wonderful for somebody else, because we lose a lot of people when we talk about, would you like to train for us? You have to give up the dog after you've trained it. And that's a really tough thing for people to do. So there's myself, and then my coworker is the program director. She's a trainer and a behavioralist. She works with all of our trainers. When we get a volunteer, the first thing we give them is a little 8-week-old puppy, and they really start their trial by fire training this dog. Again, training the dog skills that the person will need when they get the dog. Behavioral shaping, encourage good behaviors, try to eradicate bad behaviors, and going out in public places over that 2-year period a lot to really make sure that this dog can handle those conditions and keep their person safe when they're finally placed. And the other day I was doing a calculation about our volunteers, and last check, they have provided over 300,000 volunteer hours to the community over the time that WAGs has been open.
Wow.
It's a 24-hour job, too. You're on call all the time. If that dog's got to go to the emergency vet at 2 a.m, that's their responsibility. The puppies live with our trainers. They'll typically take them to work. Many people work from home now, so it's a little different. But if they go to work, they'll take the dog with them. Always working on skills, always working on behaviors, and doing things like walking them around the office and doing welcomes and stuff like that.
So there's a lot to it, for sure. And can they have a dog of their own as well?
They can.
Okay.
We'll before they become a volunteer, we'll take one of our WAGs dogs in training over to the house, see how they interact. But I think I mentioned it earlier. If the person has 2 or 3 dogs, then we're looking at a pack, and it's probably not going to work out. And you have to segregate that dog quite a bit to work on stuff away from the other dogs. But 1 dog, almost never a problem. 2 could be an issue. 3 probably not.
Well, what about there's a training period that goes on with the person who's going to receive the dog? What is entailed there?
So if we train these dogs for 2 years and then just hand them over to the person and say good luck, it's probably not going to work out. So there's a training period of about 3 to 6 months, where Sarah, our program director, works directly with the person to help them learn the skills, the commands. She goes with them out in public places with the dog, making sure that they can handle the dog, and the partnership is a good partnership. So what happens is the trainer brings the dog in the first month or so of trainings and takes the dog home. And then slowly that dog is staying overnight or a weekend with the client, back to the trainer. And we kind of play that out for a while so that the dog gets the say goodbye to the trainer, but also realize that they're going on to do something else and what they've been trained for. It usually
It's interesting.
It takes usually 3 months, but it can take longer depending on the person's abilities and things like that.
Yeah. Annie in De Pere has something. Let's go there. Annie, hi. What's on your mind?
Hi, thanks for taking my call. I just wanted to say I have the utmost respect for service dog trainers and the whole program. It's absolutely wonderful. I myself have a golden retriever who's therapy dog trained, which you did a good job of explaining. And when I have him out, he actually has a vest that says, "Please pet me," and then I take him to elder homes or schools or so on. But one thing that I have found helpful is to mention to people, because sometimes parents will grab their kid and say, "You can't touch him." And so I will say, no, this is a therapy dog, and the therapy dog is for everyone. A service dog is for just one person. So I just try to give a little bit of education, because I think it is confusing for people. And so just try to emphasize that this one is for everyone's enjoyment, and he's doing a different kind of a job. So thank you for your good work.
Oh, thank you. And that's a wonderful way to put it, that therapy dogs are for everyone. Service dogs are trained specifically for one person. And it's nice to hear that you have the vest with the patch on it that says, "Go ahead and pet me, I'm friendly." I have a demo dog that I take around. She's very young right now. I had one for 11 years. Now I have a new one. Wasn't ready to bring her with all this equipment. But same thing, I have a vest on her, and it says, "Please pet me, I'm friendly," because I'm going out and talking about service dogs, but also making sure that they know that they should always, if they do see someone with a service dog, it's okay to pet them, but talk to the person first. Don't go straight for the dog. And learn more about what the dog does for them and things like that, because one of the wonderful things that our service dogs do for people is it increases their social interactions. I can't tell you how many people come to us and say, when I would go out in public, people would look the other way, wouldn't want to talk to me. Now that I have a service dog, I'm a magnet. People come right over. They want to know what the dog does for me, how it was trained, and things like that. So that's a truly wonderful thing as well.
I hadn't thought about that, but that's great. Another great thing about service dogs. Frank called, but couldn't stay with us. He knows, he has a friend who is on oxygen and has a service dog, and her service dog can tell when she is low on oxygen.
Isn't that amazing? I don't know exactly how you train for that, but sometimes the bond can be so intense between the dog and the person that they can learn skills like that. Especially if that may be one of the only things that it does for that person, it can really focus on that. But yeah, I've heard things like that. It's amazing. It's like the list of things that service dogs can do just keeps getting longer and longer.
That's amazing. Are there accommodations, or let's put it this way, what accommodations should employers be making for employees with service dogs?
Well, the federal law talks about reasonable accommodation. What kind of agreement can you come to that makes sure that the person can bring their service dog every day and help them? But the workplace might have some concerns as well, and so that there has to be a discussion and a dialogue and figure out what's reasonable to make sure that everybody's as happy as can be having a service dog there. And it could be something silly like, well, what do we do about the dog going to the bathroom every day? Which, if you have a pet, it happens all the time. And so we come up with an accommodation to make sure that we can figure that out. But honestly, we really don't. I'm trying to think of a problem we've had, and people are very sensitive to how much a service dog can help that person, their employee, and they typically bend over backwards. It happens with our trainers too, because they take their dogs to work. And maybe we have to figure out a couple little things, but it almost always is 100% successful.
Somebody else is wondering, what other animals can qualify as service animals perhaps under Wisconsin law?
So federal law is dogs and, believe it or not, miniature horses. I don't know how that stayed this long. It stayed it stayed there forever. Wisconsin, it's not as clear. And I mentioned this legislation earlier that's it came up. Maybe they didn't vote on it yet, or they're still working on it. But Wisconsin wants to match up that definition with federal law so that it is only service dogs and service miniature horses. I can't imagine Wisconsin allows cats or lizards or birds or anything like that. So,
what is the current demand for service dogs?
Well, just speaking from our organization's experience, COVID really put a bite on us. Many of the people that are looking for one of our dogs not only have mobility issues, but also have quite a few medical conditions. And so when COVID came along, we lost our entire waiting list. People just didn't feel like they had the ability to work with us one-on-one, face-to-face. That training for a person really can't be done over Zoom. It's got to be one-on-one. It's got to be out in public places, et cetera. So the demand is starting to come back. In the past, we would have 10 to 12 people on our waiting list at a time. That's less than half now, but we're also one of the nice things about COVID was we started placing our dogs in Madison Metropolitan School District schools. We would place one of our dogs trained exactly like a service dog, has all the skills, has the temperament because they're going to be around children and youth. We'll place them with maybe the school nurse or the school psychologist. We even have one placed with the top safety director at MMSD. So they've taken many of our dogs, and it's been a really wonderful thing for, like your caller said earlier, everyone at that school to enjoy. But that's the demand is going to come up again the further and further away we get from COVID, and people are feeling more comfortable.
I'm wondering, let's say there's someone with a service dog, and now they are, getting worse in their own health, and they can no longer properly care for their service dog.
Mm-hmm. Yeah, that's a concern. We are always, especially as the dog gets, 8, 9, or 10, we're checking in more and more with that client to make sure that the dog is still providing the same things that it had when we first placed it. Many times the answer is pretty close, but it goes down from there. We always offer to place the dog with somebody else if they want to have a successor dog. Almost always the dog goes with another family member where they can still be in contact with it after it's retired. It's always better to retire the dog than have it pass away while it's still working, because we can either work on a second dog or make sure that dog can enjoy its retirement.
Well, yeah. So, and the typical length of time, or is there a standard, or is
It's different. We had a service dog recently go all the way to 15 and was not providing the same level of skills it was before, but still doing a little bit. And the person was perfectly happy with that. Unfortunately, more and more we're seeing, especially with Goldens, cancers taking dogs a lot earlier than they should be, which is really unfortunate. But yeah, it really depends on the dog.
And does veterinary care differ at all?
No, there's no difference.
And what about help? What about your organization? You're probably, I don't know how your funding goes, but...
Yeah, well, we're a charity, and we made a decision a long time ago to just be a charity that takes private donations. Mm-hmm. As the fundraiser for WAGs, I can tell you I have an advantage with, I have puppies on all of our stuff. Who doesn't want to give to service dogs? So my job isn't as hard as other fundraisers at other organizations. But yeah, individuals, businesses, foundations, all provide us enough support to keep going.
And it's wags.com.
Wags.net.
Wags.net.
Yeah,
WAGS.net.
The .com is for wives of footballers, so don't go to that one. It's wags.net. And we are always looking for volunteers, so if something you might be interested, contact us at our website.
Aaron, a pleasure. Thank you so much.
Thank you for having me.
Aaron Becker, our guest, Executive Director of WAGS. It was great to have him with us, and I wouldn't mind having him back again sometime down the road, so we'll get him back. Thank you for listening, and stay with us. Lots in store on WPR News.